You say not accessing treatment. Is it a communication thing, as in they just don't know that it exists in their backyards? Is it that what is the need there for those
Yeah,
people
it's a
to kind of get that?
combination. Sometimes it's that, right? Systems need to provide better communication so that people are aware of services. There's sort of deserts where services don't don't exist.
Mm,
Even in an urban state, like Massachusetts, there are pockets where it's hard to access services, particularly if you're someone who, maybe you're in poverty, you don't have access to transportation, it's hard to get to services, or particularly if you live in rural parts of this country where services just don't exist, you have a lot of those challenges. You know, Teletherapy, telehealth is a thing. It works for many people, but many people in this country still don't have access to broadband internet. So they don't even have access to do teletherapy. So there's lots of those challenges. I think many providers like Bay Cove and other providers, in Massachusetts and across the country, if we had, more resources to, expand outpatient services, provide access to affordable housing, employment supports, we could reach more people. We can only take it so far.
What do you think we're at right now in a space of also Chat GPT, right? Where people like I've heard some say that they'll talk to ChatGPT as a therapist. What
Yeah.
is your thoughts
Yeah.
on that? I mean, obviously not the best as something, but what do you think on that?
Yeah, I think there's lots of potential, with AI, ChatGPT, and it's rapidly evolving, and we sort of got to watch it. I look at it as, I mean, we're a nonprofit provider. We rely largely on government funding, for our services. There's not always a lot of money for innovation, and how do we start to think that way and use it?
Hmm.
And there's some culture change, right? How can it make us work faster? How can it help us think about, even our interventions? It doesn't necessarily have to replace clinical thinking, but it can inform clinical thinking. How can it help us with our improving our overall performance and, key performance measures and helping us keep track of those things. But I think there have to be guardrails, like there's a whole industry of apps that are out there now for people
Yeah.
that they can just download and, get their depression scores and get therapy and things like that. And that's the wild, wild west in that industry, and, does it help people? Sure. Are there probably some best practices in there? Sure. But we have to sort of caution about, look at some of these, are there the right guardrails to make sure that if someone's using an app or the technology to help guide them through their engagement to treatment and things like that, that there is some evidence based and it's tested so that they can rely, they can trust the source that they're going to.
Yeah. I just really also think like while it's great, it's a really good tool, that person to person interaction, it's just there's nothing like it. Even this is great. But I was just talking to my partner, and I'm like, man, one thing is about doing a podcast virtual, but what a podcast looks like in person is
Mm.
completely different because the energy is different, right?
Yeah.
The relationship becomes a little bit different. So while I do love the AI world, I
Yep.
do feel that we're in a space that it has that face to face. It's someone to understand, have that empathy and things like that. So yeah, cool world, but yeah, I definitely see the guardrails as well because
Yeah.
everyone's going to believe everything that these apps give them, right?
Yeah.
If I can sound
Well, I
crazy.
mean, you have to think too. I mean, there's, how many people, 300 million Americans in this country, or even, think about the rest of the world, and everybody's different, right? Some people are going to want to interact in the office with a therapist. Some people are going to value the teletherapy relation.
Uh-huh.
My
Yeah.
wife is a teletherapist. Her practice is built around doing teletherapy. Other people, they're on social media and they enjoy those apps and things like that. And there's a role for that too, right? You just got to sort of make sure there's some evidence base to support it. And that's hard for us as an industry to do, is sort of develop that evidence base.
Yeah. How big is the organization? Like, how many people are you serving? 2025 just ended. You guys got a stat on how many people kind of
Yeah, so we,
went to?
we serve about 25,000 people a year at Bay Cove.
That's pretty good.
We have 2,000 employees, so we're a big employer. We serve the greater Boston area, down through eastern Massachusetts, out onto Cape Cod. We're an important service provider and community member in many places, but I also look at us as it's important for us to be a good employer too, right? Because we
Hmm.
employ 2,000 people,
Absolutely.
and when people go to work, they should enjoy their job and the place that they work at, and that's an important thing for us too.
I'm put you on the hot seat here as well, real quick. So you talked about 2,000 employees.
Yeah.
What are the values as a leader that you put out there that you hope that they take?
Yeah. I don't know. I've sort of learned throughout my career, first and foremost, is just be genuine and treat people with dignity and respect, right? Like you got to have that first. Um, and then when I'm working in an organization, there's big things that we deal with every day, huge.
Mhm.
But at the same time, it's keep it simple, listen first, and be humble. I always tell people, and I hope like some of the things that I try to live by are also modeling how I sort of want our employees to sort of work and engage. And I will always say to folks, I know what I know, and I know what I don't know, right? And so that listening, being humble, if you sort of bring that to the organization, you can generate a lot of respect with your employees. And it's hard for me to know every single employee's name, but when I go out and talk to employees in our programs, I want to be able to have that level of engagement that, I'm genuine, they're genuine, they're talking to me person to person, not employee to CEO, those are important things for me.